Well, the state's largest measles outbreak in more than 30 years has come to Central Texas. On Friday, staff with the Texas Department of State Health Services contacted the Hays County Health Department about a person who tested positive for the virus. The health department manager says a person from Gaines County visited San Marcos on February 14th to tour Texas State University. That person also ate at Twin Peaks restaurant. Hays County health leaders are warning people who visited those locations may be at risk, so it is important to know the symptoms.
Which is fever, sweating, runny nose, teary eyes, as well as white small dots that may develop in the mouth. We're asking them as soon as they notice those symptoms just to go ahead and isolate themselves.
Hays County health leaders say they now have a list of people who may have been exposed. Because they are in the early stages of their investigation, they will reach out to people who are unvaccinated first.
Now, the Texas Department of State Health Services says that same person also visited the University of Texas at San Antonio on February the 15th. They then visited Tussauds Wax Museum, or Wax Works Museum, Ripley's Believe It or Not, and Ripley's Illusion Lab before having dinner in San Antonio at Mr. Krabby's in Live Oak. On Sunday, that person also visited the Buc-ee store in New Braunfels. Now, if you were at any of those locations, officials say you should be aware of any symptoms you may have.
If you think you were exposed to the virus, you want to contact your local health department for further instructions. If you develop symptoms, do not leave your home and call the health care provider immediately. Do not go to your doctor's office because you could expose others to the measles virus. Health officials say the best way to prevent measles is to get the measles, mumps, rubella, or MMR vaccine. They say 90% of people who are not vaccinated or have not had a previous measles infection will in fact become infected.
Now, children as young as 1 year old can get that MMR vaccine. According to the CDC, kids can get their first dose between 12 months of age and 15 months of age. The second dose between 4 and 6 years old. Anyone over the age of 18 who does not have any kind of record of vaccinations will need 2 doses of the vaccine, each dose separated by about a month. The CDC says 1 dose of the MMR vaccine is 93% effective at preventing measles, but 2 doses raises the effectiveness to 97%. Breakthrough infections among those vaccinated can happen, especially in areas where high levels of the virus are circulating. Those account for about 5% of cases.